Hi and welcome back, guys. We're here to talk a little bit about cats that are not peeing normally. All right, this is a fairly broad stroke statement. These are cats that are, in the box a lot, whining, having a hard time going. You can see that they want to go. They seem to be making frequent trips, but nothing's really happening. Maybe you've got a few spots of urine, but you just don't see those normal clumps if you've got that clumping litter. So this is essentially going to fall into this broad umbrella we call feline lower urinary tract disease. Something is causing a problem. We just have to sort out what that is. So let's talk a little bit about a few things that can happen. All right, so the first thing we have to sort out when we have a cat who's definitely not peeing normally or something's going on with them peeing is we have to make one of two very humongous decisions. And it should be an easy one. Are they a boy or are they a girl? If your answer is they're a girl, we can at least breathe easy thinking this might be that simple urinary tract infection, because that is always a possibility in a female. Not saying it's impossible in the boys, it's just a heck of a lot less common. Why is that? Same reason that in humans we see that same tendency. Females struggle with UTIs. It's their anatomy. It's the distance between those two parts of anatomy. Fecal output, urine output, very close in females. Males, we have enough complexity and distance there to prevent against that. So UTIs are less common in the boys. So if we have a female, the big things we think about, if they're in and out of the litter box, peeing a lot, urinary tract infections are totally reasonable. We're going to need a urine test to prove that, but that is absolutely something that we can see. But it's not always that, okay? More commonly, it's not that. More commonly, we're seeing the big, huge common one: feline idiopathic cystitis, feline lower urinary tract disease, feline urologic syndrome, all different fancy abbreviations have come up just to fog the ultimate understanding of what we know to be this inflammatory process in a cat's bladder. The bladder is their stress organ, or at least one of their stress organs, and a cat, for any good reason or any no good reason, can decide that they are stressed. Sometimes it's easy. You just had Thanksgiving, you had the family over, you had a young nephew, a toddler chasing the cat around, you've added new cats, you move the couch 2 inches to the left. Something has stressed out our cat, and how are they manifesting it? As sterile, so an uninfected inflammatory process in their bladder. So that can do it. That's probably the most common, and for that we use a kind of a gamut of treatments. We'll go into that in a bit. Now, other big things we see: stones. In younger cats, middle-aged cats, a stone will cause the exact same signs as that sterile cystitis and as a urinary tract infection. So now 3 different things: stones, just an inflammatory process, and a simple UTI that will all cause it. Now, this is rare in cats, but I've had weeks on the floor here in the clinic where I've seen 2 in a week. Cancer in the bladder. Something you worry about much more in an old cat, obviously, than in a younger cat. Cancers are more common in older patients, but that is another consideration. That list covers the vast majority of the things that we know to cause this problem. Well, how do we treat them? Well, if it's urinary tract infection, and we've proven that with a urine test, antibiotics should do it. In some cases, a culture may be indicated if you've got a repeat offender, but antibiotics should wipe that out. Simple, done. What about the cystitis cat? Okay, so the ones having inflammation. Well, we also have to know, do they have crystals? Because that's a common component to this perfect storm that creates this inflammation. Or is it basically just a bleeding process? If it's as simple as that, it's a stress reduction. Your vet can talk to you about some foods out there, some medications for stress reduction, and some simple over-the-counter things like pheromone diffusers that can help. Usually increasing water intake to encourage lots of water to help dilute and flush this inflammatory filtrate from the bladder. And pain medication. Those 3, and in some cases something to relax the urethra, but generally the pain medicine, stress reduction, increasing fluid, that alone will allow this process to be self-limiting if the patient's otherwise healthy. Now, to back that up, why do I say otherwise healthy? Well, because even though stress is on the outside, again, the nephew, the Thanksgiving, all those things I mentioned can be your stressor. Sometimes that stress event isn't because of an internal stress. So a cat who's otherwise sick with any ailment can also get a secondary stress cystitis because they're suffering from that illness. So Blood work will also be a part of that in some cases if the clinician or doctor or veterinarian feels appropriate. Stones, we touched on that. That is its own issue. Generally in those cats, we need to see urine to figure out, or at least hopefully speculate on the stone's type by looking at the crystal type, and then we can attempt to dissolve should we suspect a stone that is dissolvable, or often you're discussing surgery. So you can see how a cat, a female cat, going in and out of the box can have any number of possible reasons, and for each of those reasons a different treatment approach. So it's not always a course of antibiotic, and your vet's going to have to help you troubleshoot what to do next when you see that. Let's talk about the boys. Let's take a quick look at this bladder of a cat. This is an x-ray. Here's our spine, the pelvis, and the back legs. This is the body wall coming down here. Look at this bladder. This is a bladder actually of a cat that came in for a urinary blockage. These are the boys with the blockages, and this bladder, when I felt it, was very hard. You don't see stones. This cat's actually oriented laying on his side, which means the bowl shape of that bladder would actually allow stones to fall towards the center. This is really not a great x-ray. I'm partially covering up our client information, but in this x-ray you'd also want to be able to see further back, and I have other views that show that, because sometimes their stones are nice and easy right in the middle of the bladder. Other times they're located anywhere along this passageway towards the penis, where of course urine needs to go. And that blockage can be occurring up there if indeed is caused by a stone. This cat had no stones, but this bladder, despite looking fairly uniform, contained lots of blood, lots of crystals, lots of stuff that needed help. This guy had to go to a sedated procedure to have this urethra patency recreated with a catheter and maintained in the hospital until his inflammation calmed down, okay, and until his azotemia and those consequences of being blocked were dealt with and resolved. So again, interesting looking bladder here, and in his case, good outcome. The male cat, totally different animal altogether. When we see a male cat coming in, we're right away, our mind switches as to the kinds of problems we could be facing. Why are male cats so different? Well, first of all, urinary tract infections, we can pretty much take that off the table. Can't eliminate it because they can occur. They're just so unusual in the male cat because of their natural resistance to that type of a process happening, the infection process. So that means we're stuck with the inflammatory process, which may be straight up bleeding and the clots that come with that, or that may be complicated by urinary crystals that are also kind of agglomerating in there with the blood and creating these mucousy plugs that can then, of course, be our huge issue. The stones. Male cats are equally prone to stone production as females. They can be of multiple different types. Stones that can dissolve, stones that can't dissolve, stones that have layers that would and layers that wouldn't, all of which pose in their own unique clinical challenge. And then, of course, the tumors, again, less common in cats and something we find ourselves less often looking for, but when we've exhausted all of the other diagnostic scenarios, we may reach for an ultrasound and look for a tumor in the bladder in a cat, even in a cat, whereas that's typically more of a dog problem. Cats will get them as well. So what makes the male so unique is because their urethra is more complicated. It's narrower, and some cats are even more narrow than they should be. They're genetically very narrow in the urethra. Now, why that's a problem is all this sludge and or stones, when it tries to pass, whereas a female can accomplish that, up to a degree they can accomplish passage of this stuff, males inevitably do not. And more often than not, the male cat becomes blocked. They cannot pass anything. The kidneys don't care. They keep doing their job, keep producing urine, keeps pushing it into this dead-end bladder that can't get rid of it. And you end up with a cat who then gets very sick because those toxins back up into the bloodstream and they get what we call azotemia. Okay, and other electrolyte and acid-base changes all happen, making some of these cats very critically ill. Okay, so very, very big problem in these guys. So the same process. Your vet will get a look. They will feel for blockage. They will tell you whether or not we are blocked, and that scenario goes right down the avenue of anesthetics, procedures to unblock, and appropriate care from there. Or is that bladder empty? Much better scenario. If it's empty, we have the luxury of being able to get our x-rays or urine, find out what our results are, and treat accordingly. But the bottom line here is whether you have a female cat or a male cat, both having a slightly different urgency basis based on their predisposition for trouble. It's not straightforward as to what they're dealing with. Infection is only a small piece of the very big pie that makes up the complexity of a urinary problem in a cat. And it's very important that we tie the exam in with the test results that we get to figure out what's wrong. So guys, you see an issue, your cat's visiting the box, you just don't know, see your vet. Have them get a look, have them work through the diagnostics to sort it out. And hopefully we can get these guys out of the box, back in the game sooner than later. So as usual, thank you for watching. Any questions or comments, keep them below, and I'll do my best to answer. Till next time, thanks so much, guys.